My name's Alexandra Scranton. I'm the Director of Science and Research at Women's Voices for the Earth. This is a great question, and it's one that companies really need to be held accountable for answering. There's an unfortunate, pervasive cultural myth that menstruation is associated with unpleasant odor. And this misbelief leads to feelings of shame, insecurity, worry, and overall low self-esteem in many people who menstruate. As a result, a lot of effort gets spent and products get invented which make promises of reducing, eliminating, or covering up that unwanted supposed odor. But the reality is so far from what many people think. Periods are perfectly natural, they are normal processes, and there are considerable hormonal changes that occur that can alter your bodily processes, including, most importantly, it can alter your sense of smell. So yes, you might smell things differently during your period. You might pick up scents that are always there, but which you notice more at certain times rather than other times. You might be familiar with the concept of pregnancy nose, where you can smell a lot more things when you're pregnant. This is also largely hormone driven. But the reality of an outward menstrual odor to anyone else is that there are very, very subtle changes in odor, if any at all. But the manufacturers of many menstrual and intimate care products don't want you to know this, and they're actively promoting and heightening insecurities about period odor in order to sell more of their products. What they're telling you is not true, and it's not fair. And I know this can be hard for some folks to believe. It's a really well-ingrained myth, but you are just fine during the days of your period and every other day. And don't let a company's marketing team tell you otherwise. The answer is, sadly, odor control technologies are far from proven safe. The reality is there's a lot that we don't know about them. In many cases, manufacturers have just not been transparent at all about the additives they use to capture odor in various products, things like Odor Lock, Nutress. There are lots of catchy names for the technology, but companies have generally not disclosed what this stuff is even made of. They certainly have said almost nothing, at least until very recently, about what's in the fragrances they use to scent some of these products. And the reality is there's no published research at all about whether any of these additives or fragrances are in fact impacting vaginal health. At most, companies may have done some test trials to assess for irritation from using these products, but longer-term reproductive health studies or studies looking at the impacts on healthy vaginal bacteria, these studies simply have never been done, leaving you as the customer as the guinea pig. And there are some real reasons for concern. For example, a study conducted a few years ago by the National Health Agency in France did some testing of menstrual products, and they detected a fragrance chemical called lilial in scented panty liners. Now, lilial is a known reproductive toxicant. It can affect fertility, possibly pregnancy outcomes, and it's actually now banned in the European Union for safety reasons. Now, this sounds like a particularly bad idea of a chemical to add to panty liners that have vaginal and vulvar contact. And to take that kind of risk for what supposed benefit, just to add some unnecessary scent? There has been no research to find out what reproductive harms may be linked to lilial in these products and for the people who use them. We really have no idea, but we do know there's a lot of unexplained infertility, there are unexplained reproductive problems out there, we don't know what they're caused by. Now, similarly, the use of silver as an odor control technology has been incorporated into a number of menstrual products, from negative ion strips in pads that contain silver to silver finishes in period underwear and incontinence products. Now, silver is a potent antibacterial, so the theory is that there's odor-causing bacteria that builds up either in your menstrual products or on your body during your period, which can then be eliminated or prevented by the presence of silver. Now, there are two main problems with this theory. One, there's little to no research on these supposed odor-causing bacteria, right? And whether or not there are any more bacteria during your period compared to any other time, whether or not you're wearing a menstrual product long enough for this bacteria to actually build up and cause a noticeable odor. We've never done this research. And of course, back to a previous point, like whether or not this potential odor even exists is an issue. Now, what we do know about silver is that it's also really effective at killing lactobacillus. Now, lactobacillus is a really important bacteria that inhabits a healthy vagina. And so there's no published research that's looked at the effect of silver in menstrual products on this balance of healthy vaginal bacteria. And when vaginal bacteria get disturbed and unbalanced, numerous health problems can arise from that. So manufacturers of these products, they're responsible for making sure these products are safe. And they've really let us down by incorporating silver and other additives into their products without looking into the safety carefully enough. Silver can be a real potential threat to health. It can be a real threat to our environment. And again, for what supposed benefit? It's there to ease the insecurities of menstruators that have been hyped up by these same companies in the first place. It's really solving a problem that has largely been invented for you. It's absolutely unnecessary, it's harmful and unconscionable. We need to ask companies to do better. This is another great question. It's an issue that needs a lot more research and attention. Similar to menstrual and intimate care products, lubricants and sex toys share that unique aspect of having direct genital exposure. And this kind of a chemical exposure from products like these is unfortunately rarely investigated. But there are some things we do know that can cause concern. There's some relatively recent research on lubricants that's important to know. Lubricants, for one, are designed to lubricate vaginal or rectal tissue, often in an effort to make sexual activity more comfortable or pleasing. And generally, the immediate effect of these products tends to work for most folks in the moment. The concerns, however, are the after effects. How are the chemicals in these products affecting this sensitive tissue over the long term? And unfortunately, for some products, the research just doesn't look good. Some lubricants, for example, have a pH. The pH is the level of acidity in the product. And they have a pH that's pretty incompatible with the healthy pH of your vagina or rectum. Your best bet is a lubricant with a pH of 4.5 for vaginal tissue or a pH above 5.5 for rectal tissue. Now, of course, most companies don't advertise the pH of their product, so you'll actually have to call the company and ask for it. Now, a second issue is one called osmolality. The osmolality of a lubricant determines how much moisture will be drawn out of the tissue you apply it to. So if the osmolality is too high, which unfortunately with lubricants more often than not is the case, the lubricant can actually pull moisture out of vaginal or rectal tissue, causing it to shrivel up and break down. Now, this disruption is both irritating for one and can significantly increase the risk of infection. Not what you want from a lubricant. So ideally, you want a lubricant with an osmolality less than 1200. And again, you're going to have to ask the manufacturer for this information. Most often, it's not disclosed. Lastly, there's a wide range of chemicals found in lubricants. There are things like preservatives, like parabens, to flavors and fragrances. And again, the news isn't great. There's not a lot of research, but some of the research we've found, which has tested commercially available lubricants, has found some brands to have adverse effects on vaginal cells. Some of them can harm sperm. Others can kill off important healthy vaginal bacteria like lactobacillus. Lubricant manufacturers really have got to get it together. They need to do the research that's necessary to make sure their products are not just effective in the moment, but safe in the long term as well. As for sex toys, again, there's not a lot of research out there, although they are often made of relatively inert materials, which is a good thing. Now, one good news story is some research we did a few years ago when we became concerned about the possible presence of phthalates, which had previously been found in vibrators that are made of PVC plastic. Now, phthalates are chemicals often found in PVC, plastic, or vinyl, and they're chemicals that can soften the plastic, but they're also potent reproductive toxins. Now, the good news is that our testing in 2019 found that these newer brands are largely no longer made of PVC or vinyl, so that's good. And then the ones that still were appear to be phthalate-free. So this is a good news for the industry. You still want to look for products that aren't made of PVC or vinyl, but at least there's some good news in that arena. Thanks.